I want you to picture a map of the world. Okay, now zoom in on the southern coast of China. Now imagine you overlay a heat map of cancer cases. For, most cancers, that map is going to look pretty random. It's scattered.
Sure, you'd see clusters, but they'd be all over.
Exactly. But there's this one specific cancer that lights up this one region so intensely, so exclusively, that for decades doctors have just called it the Guangdong tumor.
It's a really striking nickname, isn't it? And it's accurate.
It is.
What we're talking about here is Nasopharyngeal carcinoma, or NPC.
Yeah.
And while, yes, you can find cases elsewhere, like among Inuit populations or in parts of North Africa, it is overwhelmingly endemic to South China.
It creates this incredible epidemiological mystery.
A tragic one, but yes, a mystery.
That's exactly how I want to treat this deep dive today as a detective story. Because when I was going through the research, it didn't read like a standard medical paper.
How so?
It felt more like a crime novel. You have a very specific scene of the crime, this hidden cave in the head. You have a perfect storm of suspects. We're talking genetics, a virus, and a very specific kind of food.
Right, the triad.
And you have this villain that disguises itself until it's almost too late.
That's a perfect framework, because clinically, that is exactly what we're up against, this tumor. It's a master of disguise, and it hides in one of the most complex, difficult to reach anatomical boxes in the human body.
So let's start there. Let's map out that crime scene. When we say nasopharynx, I think most people, myself included, just picture the back of their nose.
That's the common assumption.
But looking at the diagrams, it's not really the nose, is it? It's more like a bunker.
Bunker is a great word for it. Think of the nasopharynx as a small, pretty rigid box sitting deep behind your nasal cavity, just above the back of your throat.
Okay.
And to really get why this cancer is so dangerous, you have to understand the walls of this box. It's very tight real estate.
Right, I was looking at the boundaries. The roof isn't just soft tissue, it's the skull base. Specifically the basis sphenoid and basic occiput bones.
Exactly. And just think about what that means for a second. The roof of this room is the floor of your brain.
So if a tumor breaches that roof.
It's knocking on the door of the cranial cavity.
Wow. And the back wall is that your spine?
Yes. The first and second cervical vertebrae, C1 and C2, and the muscles right in front of them. So you've got solid bone on top, spine in the back. It's a cage.
Which brings us to the main hiding spot. I saw this term in every single paper we looked at, and it sounds like something out of a horror novel. The fossa of Rosenmiller.
The fossa of Rosenmiller, yeah, it does sound ominous.
But what is it?
In anatomical terms, it's just a recess. A deep slit, really, on the side wall of the nasopharynx. It sits right by the opening of the eustachian tube.
But why there? Why is this specific little pocket the epicenter for so many of these tumors?
Well, partly because it's a blind spot. It's a deep crevice where, tissue can accumulate changes without being noticed.
Hidden away.
But more importantly, look at where it sits. It's a crossroads. In front of it, you have the eustachian tube. But right above it, and this is key, is the foramen lesserum.
The foramen lesserum, that's the ragged hole in the base of the skull, right?
Correct. It's basically a chimney. So if a tumor starts in the fossa of Rosenmiller, it has a direct elevator shaft up toward the brain.
Oh, wow.
And there's another structural weakness right there called the sinus of Morgani.
I circled that in my notes, the sinus of Morgani. It's described as a gap. Did nature just leave a hole in our defenses there?
In a way, yes. It's a gap in the muscular wall between the superior constrictor muscle and the skull base.
Why?
Well, nature left it there. So necessary things like the eustachian tube and the levator palatini muscle could pass through. But for a cancer, that gap is just an open door.
The path of least resistance.
Precisely. The tumor doesn't have to burn through tough muscle to spread. It just follows the path through that gap and into the space next to the pharynx.
That is it's unsettling. A hidden cave sitting next to an open door, all tucked right under the brain. So that's our scene of the crime. Now let's talk suspects.
The triad.
Right. You need these three things to create the perfect storm. Genetics, a virus, and the environment. Let's start with genetics. The lock.
This really helps explain why it's the Guangdong tumor. It isn't just about living there, it's about the DNA of that population. There's an incredibly strong link to the HLA locus on chromosome 6.
And HLA is the human leukocyte antigen system, the security guard of the immune system.
That's a great way to put it. They tag cells as self or intruder. And in this specific population, we see these high-risk markers, alleles like HLA-A2, A33, and B46.
So if you have these markers,
your security system is, it's basically prone to falling asleep on the job when it comes to this specific cancer.
And I read that it's even deeper than just susceptibility. Your genetics can actually dictate your survival odds.
They do. This is where it gets really granular. We know certain haplotypes like A33 and B58 are associated with a much poorer prognosis.
So your genes don't just open the door.
No. They can determine how hard the fight is going to be.
Okay, so the genetic lock is picked. Now the perpetrator walks in, and this is the part that just blew my mind. We are talking about the Epstein-Barr virus, EBV.
Human herpes virus 4.
Which is so common. I mean, this is the virus that causes mono, right? The kissing disease. Most of us have this in our bodies right now.
That's the multi-million-dollar question. You're right, EBV is ubiquitous. It usually infects our B lymphocytes, our white blood cells, and then it just goes dormant. It sleeps in your bone marrow.
So why does it cause nose cancer in South China?
Because in NPC, the virus does something completely distinct. It becomes what we call lymphotrophic in a very aggressive way.
I was reading about the researchers who pinned this down, Liang and Yang et al. They didn't just find the virus nearby.
No, that's the smoking gun. They found viral DNA inside the tumor cells themselves.
So it's not a bystander.
It's an architect. The virus essentially hijacks the epithelial cells of the nasopharynx. It inserts its own genetic material, and this messes with the cell's off switch. It basically tells the cell, don't die, keep dividing.
It pushes the cell toward immortality. That's terrifying.
It is.
But again, millions have the genes, billions have the virus, so what pulls the trigger? What's the final piece?
The environment. The crowbar, if you will. And this brings us right back to the culture of South China. Specifically, the diet.
Salted fish.
Salted fish. It sounds so innocuous, doesn't it? A staple food.
Comfort food.
But the traditional way of preparing it, salting it, letting it ferment for a long time, that creates a really potent chemical cocktail.
Nitrosamines.
Volatile alkylating nitrosamines, to be precise. These are powerful carcinogens. And it's not just that people eat it as adults. The research points to a very specific cultural practice.
Weaning.
Yes, weaning.
Yep.
I saw you had that in the notes. It's common practice to feed this salted fish mash to babies as one of their first solid foods.
So you're introducing these carcinogens at the most critical developmental window.
Exactly. You have an immune system that's genetically susceptible, a body that might already have EBV, and then you add high levels of nitrosamines. It's a cumulative load.
Wow, it really is a perfect storm. The genes load the gun, the virus aims it.
And the salted fish pulls the trigger. A very apt way to put it.
So we've got a tumor growing in the fossa of Rosenmiller. What does the patient actually feel? Because if I have a tumor in my nose, I expect a nosebleed or a stuffy nose.
And you might get those eventually. But NPC is famous for being a chameleon. The first symptoms are often silent, or they appear somewhere completely unexpected.
The stat that shocked me was that for half of all patients, the very first sign isn't in the nose or ear at all. It's a lump in the neck.
It's frightening, isn't it? A painless neck mass. This happens because the nasopharynx is so rich in lymphatics. The cancer spreads to lymph nodes very, very early.
But not just any nodes. I struggled with the anatomy here. the nodes of Rouvier.
Right. So usually when we get sick, we can feel swollen glands under our jaw. They're accessible.
Sure.
But the first stop for NPC is the retropharyngeal nodes, the nodes of Rouvier. These are deep. They sit behind the throat, right up against the spine. You can't feel them, you can't see them.
So the cancer is spreading, hijacking these deep nodes, and the patient feels absolutely nothing.
Until it spills over. It moves to the next level, the upper deep cervical nodes. That's when it finally pops out as a visible lump in the neck.
By which time it's been there for a while.
Very likely, yes.
Okay, so a neck lump is the big red flag. But there's another cluster of symptoms that has this very specific name, Trotter's triad.
Yes, Wilfred Trotter, a brilliant surgeon who noticed a pattern. It's a specific triad of symptoms that tells you the tumor is growing sideways.
Let's break that down. Symptom 1, deafness.
Specifically, ipsilateral conductive deafness. So one-sided hearing loss. That tumor is compressing the eustachian tube. Fluid builds up in the middle ear.
So an adult who suddenly feels like they have water in one ear that just won't clear.
That's a major warning sign.
Symptom 2, neuralgia.
Pain, but not in the ear, in the side of the face or the head. The tumor is irritating the trigeminal nerve, the fifth cranial nerve.
And symptom 3, palatal paralysis.
This is the really strange one. The patient might notice their voice changes or they start to choke on water. The tumor has hit the vagus nerve, so the soft palate on one side just stops moving.
Deafness, pain, paralysis, that's the triad.
That's Trotter's triad.
It's a checklist of destruction, and if it's not going sideways, it's going up. Through that chimney we talked about, the foramen lacerum.
Exactly. Once it's in the skull base, it starts taking out cranial nerves like a sniper.
You see all these syndromes listed in the text, Vernay's,
It
Villeray.
can get overwhelming. It's better to think about the function. What does the patient lose?
You're right, so if it moves forward,
It moves into the cavernous sinus and hits the nerves controlling the eye. Most commonly the abducens nerve, the sixth nerve.
that's the one that lets you look sideways.
Yes. So the patient walks in with double vision because one eye is stuck looking forward.
And if it goes backward,
It hits the jugular foramen. That's where nerves 9, 10, and 11 exit. So you lose swallowing, you lose voice control, you can't shrug your shoulder on that side.
it's just devastating. It systematically unplugs the control panel for your head.
It does.
So how do we fight something buried inside a bone box under the brain? I assume surgery isn't the first option.
Generally, no. And that's the one saving grace of this Guangdong tumor. It is highly radiosensitive.
It responds well to radiation.
Extremely well.
Yeah.
Surgery in this area is a nightmare. You're navigating around the carotid artery, the brainstem. You can't get clean margins. So radiotherapy is the gold standard.
This brings us to a paradox I found in the pathology. The WHO has 3 grades, right? Grade 1 is keratinizing, and then grades 2 and 3 are non-keratinizing or undifferentiated.
Correct.
Usually in cancer, undifferentiated means wild and aggressive. That's bad news.
Usually, yes. Grade 3 cells look wild under a microscope. They're primitive. But here's the paradox. Grades 2 and 3 are the ones caused by the Epstein-Barr virus.
Okay.
And because they're so active and primitive, they are incredibly sensitive to radiation.
So having the worst looking cancer is actually better for your survival.
In the context of NPC, yes. Grade 1, the keratinizing type, is slower growing, but much more resistant to radiation. It's harder to kill. The endemic Guangdong type just melts away under high-dose radiation.
Melts away sounds great, but we're blasting the head and neck with radiation. There's a cost of the cure. This isn't just a sunburn.
No, it's life-altering. The standard dose is around 65 grays. We use modern tech like IMRT to sculpt the beam, but you can't avoid everything. The salivary glands, for example, often take a direct hit.
Dry mouth.
Xerostomia. It sounds like a minor annoyance, but imagine having zero saliva. Permanently, you can't eat dry food like bread or crackers, you choke. Your teeth lose their protective coating and they rot. It changes your whole relationship with food.
And the jawbone itself can die.
Osteoradionecrosis. If the radiation damages the blood supply to the mandible, the bone literally dies. That's why dental screening is mandatory before treatment. Any bad tooth has to come out before radiation starts.
Because if you pull it after, the hole might never heal.
It may never heal. It's a lifelong risk.
That's a heavy reality. We've covered the hidden cave, the viral hijacking, the salted fish, the silent spread. It's a lot to take in.
It's a dense topic, but it's an important one because it highlights just how complex cancer really is. It's not just bad luck. It's this interplay of where you're from, what you eat, your genes, the viruses you carry.
So if there's one aha moment or takeaway for our listener, what should it be?
I think the takeaway is vigilance and context. If you are from a high-risk group, if your family roots are in South China, and you develop one of these silent symptoms, a blocked ear that won't clear, a painless lump in your neck,
Don't just ignore it.
don't dismiss it. And don't let a doctor dismiss it as just an ear infection or a swollen gland. Ask for the scope, because that open door in the anatomy means time's of the essence.
It's the detective principle. Suspect the unlikely if the context fits.
Precisely.
I want to leave everyone with one final thought that I just can't stop thinking about. We talked about the Epstein-Barr virus. It's in me. It's probably in you.
It's in most of the world's population.
And it's just sleeping in our B cells right now, hiding in our bone marrow.
It's a chilling thought when you put it like that.
It is. It's a reminder that we are all walking ecosystems. And usually, we keep the peace, but all it takes is a specific roll of the genetic dice and a specific environmental trigger like that salted fish to wake the sleeper agent.
And suddenly the virus isn't just a guest anymore.
It's building a tumor in the dark. It makes you respect the delicate balance of biology a whole lot more.
It certainly does. Knowledge is the only way to tip that balance back in our favor.
Thanks for diving deep with us today.
Stay curious.